So now we'll today see for the carpal tunnel, and carpal tunnel will first keep the probe in a transverse axis, and then we'll see a structures over the ultrasound. Now we can see a various structures over here, and then we'll analyze one by one structure. You can say this is a lateral side. So this one is a lateral side, and to the lateral side you can see a pulsatile structure, very nice pulsatile structure, and that is a radial artery. Okay, from there you can see a very nice retinaculum. Freeze the image please. So now you can see a very nice retinaculum from here. We'll see one muscle outside the retinaculum. This is flexor carpi radialis. So outside the retinaculum there will be flexor carpi radialis and radial artery. Just watch it now. And please. So you can see a retinaculum nicely. You can see a flexor flexor carpi flexor carpi radialis retinaculum. And now when we move inside, you will find that, and please, so when we move inside, we will find a various structures there. So please freeze. Now this is an retinaculum, and you'll find that there is either one of this is nerve over there. There are tendons. Okay. So how to differentiate between nerve and tendon is, so you try to move the little bit of the probe. So you'll find that there is an anisotropy into the tendon, but the nerve does not changes its echogenicity. You'll see that whenever we move the tendons, whenever we move the probe, there are few structures which changes its echogenicity significantly, but the nerve will not change its echogenicity significantly. Did you identify that? Now I will show it to you. Stop. Look at this structure. This is a nerve. This one exactly is a nerve which will not change the echogenicity, but the tendons other will change the echogenicity. Again we'll see it. See, the nerve is not changing but tendons is changing the echogenicity when you move the probe. That is one way to identify which one is nerve. And the second way to identify is trace it superiorly. So once you trace it superiorly, you will find a nice freeze. Unfreeze. So you find the nice freeze nerve over here, and then trace it inferiorly again. So that is the nerve there. You trace it inferiorly, and you will see that nerve goes below the retinaculum. Freeze. So whenever the nerve is impinged, you have to go from medial to lateral side or lateral to medial side. Just take care that you don't hit the arteries. So whatever is whichever artery doesn't come into your picture, you can inject it from that side. Go below the nerve and go above the nerve. This should be your direction, above the nerve and below the nerve. So this is how we do a hydrodissection for the carpal tunnel.